we originally created these to try to help you guys, help you better understand what's going on, and also help your families understand what's going on. We know a lot of times you guys get diagnosed with these ocular diseases, and it's kind of like a quick, you go to your doctor, or you get a diagnosis, and it's kind of like, okay, well, you have macular degeneration, or you have glaucoma, or you have RP or something, and you're not really communicated to very well in terms of what's going on, what's the causes, what you can do about it. It's like, well, you got a genetic condition, or you got an age-related condition, or there's some autoimmune or metabolic condition, and that's it. You know, just kind of have to go home and Google it and figure it out, or go online somewhere and try to figure it out. So we want to try to fill that gap. We want to help you guys understand a little bit about your disease, a little bit about what's going on with the eyes, what you can do, what you might not be able to do, what options are available to you, a little bit about nutrition, acupuncture, diet, the role of stress. So we're going to cover all these things, and we'll also talk a little bit about stem cell, gene therapy, some of the biotechnologies. These are some things that you guys will probably start hearing about if you haven't already heard about, which will give you some information, and we could have a little introduction on that so you can better understand what's going on in terms of conventional research from that standpoint. I'm Andy Rosenfarb, for those of you who don't know me. I'm the owner and director here at AcuVision, Acupuncture Health Associates. I've been in practice for almost 20 years. We've been here for about 15 and a half years. I'd say the last 16 to 17 years, I really immersed myself into the field of Chinese Medical Ophthalmology, learning different ways to kind of help people with their vision challenges and their mostly degenerative conditions. So the talk that we want to have today has a lot to do with Chinese medicine and naturopathic medicine. Naturopathic medicine is also called functional medicine. So there's kind of this Eastern Chinese holistic style of medicine, and then also more of a Western naturopathic functional medicine. So we're going to kind of cross over those two. And towards the end, we're going to open up to questions and answers, because I'm sure a lot of the information we're going to give you guys may stimulate those neurons and get your brains going a little bit. And that's the thing about education. And we encourage that. You know, it's this, you guys should be asking questions, because that indicates that you're interested and you want to learn more. And there's a lot. So, okay, first, these are my books. First three are out. Healing Your Eyes with Chinese Medicine was kind of a general overview for acupuncturists and lay people about just to tell people and let people know that there is something you can do, that acupuncture and Chinese medicine has a place in helping these types of conditions. After that book was published about 12 years ago, we started to get an enormous amount of calls from acupuncturists and other healthcare practitioners. What can I do? I have this patient, I have macular degeneration, glaucoma. So we put together a clinical manual for acupuncturists that helps them to create clinical treatment plans and understand treatment pathologies and patterns, kind of to guide them, to help them better treat their patients. And this is kind of an assistant to our online courses that we offer for acupuncturists as well. And then we really started to get pretty heavy into treating retinitis pigmentosa and rod cone dystrophy, Usher syndrome. These are genetic night blindness conditions, and we had so I started to have a lot of questions from patients, and I decided to create a manual that explained acupuncture, explained how the disease processes come about, a lot of which we're going to go over this evening. And most recently, we did a similar type of book for macular degeneration, which is done. It's just not quite in print yet, probably about 3 or 4 weeks that'll be out, available on, and all these are available on Amazon. So again, these are all the published books. They're all available on Amazon, so most of them are Kindle format too if you want to get them, except the Ophthalmology and Chinese Medicine, because that's a clinical manual. About 3 years ago, we started a research study with Johns Hopkins on the treatment of retinitis pigmentosa with acupuncture. It was a pilot study. This is the study off of PubMed. We had about 50% efficacy, which was great. I was hoping for 25%, to tell you the truth. It was pretty challenging to create this study. My role in this was to create the acupuncture protocol and train the practitioners and give them guidance and help them field questions and if anything came up with a patient. So I really handled the clinical side of it and the training side of it. It was really difficult to create a one-size-fits-all treatment protocol for everybody. Acupuncture is traditionally done where everybody is kind of different, so we'll have some points, right, that may be around the head that can benefit eyes, but there's underlying causes. Everybody's dealing with different situations going on, and some people have inflammation, some people have autoimmune problems, some people have metabolic issues going on. So we need to understand each person's individual situation and treat accordingly. What that means is each person is going to be treated individually. It's not like everybody with RP gets the same treatment. That's not the way acupuncture and Chinese medicine work. For research purposes, we had to create a one-size-fits-all. So it was kind of a little bit of a stress and a daunting task. It was exciting to get the opportunity to do this, but to really, like, okay, well, what can I do that's going to kind of get results with everybody? But fortunately, again, the results were initially for this pilot study was much better than I had anticipated. So as a result of that, we got funding from the NIH to go on with a second study, which was conducted down at Nova Southeast in Fort Lauderdale, Florida. And we did the same type of study. There's another acupuncturist I went down and trained down there to administer the treatments to the participants. And that study has been concluded, and the chief investigator, Ava Bittner, who is working on getting that done, and we're going to get that out published pretty soon. And again, the second study is really kind of more important than the first, because in the eyes of the critics, the first study we got lucky. Right? Got lucky. Second study, all right, that shows consistency and starts to show efficacy. So for me, the second study was, the first one was like, okay, well, here we are, ta-da, acupuncture. This is, shows, okay, well, now we're going to establish a consistency and some efficacy. So after this, of course, we'd like to continue and do more long-term studies and larger studies, and we already have some major medical universities in the United States and internationally that are interested. So we want to continue more research on RP. Other conditions like glaucoma, macular degeneration are kind of at the top of the list. We really want to see more on those as well. And you guys could check that out online if you want more information. So what we're really trying to do here with everything that we're offering you guys is to improve and recover some lost vision, and we'll explain how that happens. It's not this mystical, magical, we're reviving these dead tissues and it's resurrection of dead. No, that's not the case, but we can recover some vision, sometimes a little bit, sometimes a lot, a whole lot. And we'll explain how and why that happens. And then long term, we want you to help you keep what you got. And there's things we can do to help ensure that you maintain your vision. And I've had patients that I've worked with for 15 or 16 years with these eye conditions. So I can say that in my direct experience with working with these patients, there's a lot of cases that should have been progressing, and you should have had progressive vision loss, which is what these conditions are, and they're holding. It's 15 years later, it's supposed to be, when they're first diagnosed, you're going to lose your vision, you're going to use your license, and those patients that really stuck with it, and did the supplements and did some of the homework and stuck with acupuncture and practiced some of the things, the meditations and relaxation, and really took to heart a lot of the information that we put out there, really were able to hold their vision long term. And preservation is really important. Keeping what you got. When you're told you're going to lose vision, you're on a slippery slope going downhill. To stabilize and plane out, plateau out, that's great. So, you know, I know we can offer that in a lot of cases too. Let's talk about our eyes and how they work. I found that a lot of my patients go to their eye doctors and they're told they have a condition, but you're not really taught much about your eyes. You know, maybe you remember from high school if you took a physiology class or something like that. If you have the time or inclination, maybe you went to YouTube or Google and saw different pictures of the eyes. Let's start with a real simple basic anatomy. I don't like to get too into it because you guys can also check this stuff out online, but just to give you a basic understanding. So we have with our eye, which this is, we have the anterior chamber compartment and then the posterior compartment and the optic nerve that comes off, that goes to the brain. So what happens is we need to understand the structures, particularly when we're dealing with degenerative conditions, all right? A lot of times most of these conditions deal with the retina, which lines the back of the eye. That's the nerve layer, the photoreceptor layer. We're dealing with optic nerve issues, either inflammation or atrophy or damage to the optic nerve. And we're also dealing with something called the choroid. The choroid is so important that these are the microscopic blood vessels or the microcapillaries that feed the retina and feed the eye. All right, that's where we get our food, our oxygen, and our elimination of waste, ocular waste products. So these are the smallest blood vessels in the body, and they can get clogged or damaged really, really easily. And what happens when they get clogged or damaged? No flow. It's a broken pipe, right? So that's going to impair the blood flow or the delivery of oxygen, vital nutrients, and the circulation or detoxification and elimination of carbon dioxide from the cells. So we need to keep that flow going, right? Every cell is like a miniature version of us. Needs to breathe in air, oxygen, needs to exhale carbon dioxide, needs to take in food, nourishment, and eliminate waste, okay? That all happens through our blood vessels in our body. So a lot of the conditions, a lot of the degenerative conditions and chronic inflammatory conditions, we see a lot of breakdown of the choroid. So maintaining the blood vessel health is really, really important in addition to neuroprotection and protecting the nerves, the rods and the cones and the optic nerve from progressive damage. So the eye itself works like a camera, okay? I don't know, anybody ever hear that analogy before? It does. The eyes take in the images, they take in the information, like an antenna, but the brain sees, okay? So the front of the eye, we have the lens where the light comes in, right? We have the iris that constricts to regulate the amount of light that comes in. So if it's too bright, we're outside, it's really bright, constricts to regulate the amount of light. If it's dark, our pupils dilate to increase the amount of light that comes in. So the light images are cast through the lens onto the back of the eye, which again is called the retina. The retina is a layer of photoreceptors made up of two types of cells, rods and cones, which the light images are projected upon. So those light images will go to the retina, just like it's captured on film, and then those light images are transformed into electrical signals or electrical impulses that are transported through the optic nerve to the brain, and then your brain makes sense of what you're seeing. You can see color, movement, shape, pattern to identify what it is. So when we have retinal problems or optic nerve problems, this is important for our later discussion to understand that it's really just an antenna, right? Which is kind of good in one way because antennas can be fixed. If there's a brain problem and the brain can't see or process the image, like with a stroke or something like that, or a head injury, that's a little bit more of a severe problem because the brain cells die or there's a lot of damage to them. You can't really fix that. But we can somehow improve or use, in some cases, an alternate or a synthetic or a mechanical or bionic eye to pick up these light signals and send them to the brain, which again we're going to talk about a little bit later. But just understand that that's how it works, and the light signals get sent through the eye, which is photoreceptors, right? Photo meaning light, receptor means it picks up light, sends it to the brain, and the brain's what really does the seeing. I want you guys to really understand that, because that becomes really important in terms of our later understanding of neuroplasticity and how the brain works and how we can influence that. So when we want to check our vision and see how we're doing, if we're diagnosed, like most people will go 6 months or every 12 months to their eye doctor just for checkup, as we should, and they'll check your vision. Or if they suspect, or you suspect, something doesn't seem right, or a friend or a family member notices, maybe with a child, that something's up, want to do some diagnostic testing. That's going to evaluate how well you're seeing in a bunch of different areas. So the first thing we'll check for is acuity, right? Acuity is basically your eye charts, right? Big eye chart on the wall, close, up close, what you're reading, and distance. So you want to see how well are you reading. Visual field or perimetry is, what's your visual field? Usually about 90 to 100 degrees laterally. So dead center 0, 45, then 90 degrees. Okay, so we want to see how are we seeing in this visual field. In certain conditions, the visual fields can close in on us, like in retinitis pigmentosa or optic nerve atrophy. Then there's something called ocular coherence tomography, which is a little bit more relatively new. What that does is it's a laser cross-section of the macula. So it'll help look at the structural function of the macula, and we could pick up things like edema, bleeding, fluid, drusen in macular degeneration, which we're going to talk about in a little while. So it lets us know if there's any structural abnormalities or anything that shouldn't be there in the macula that can impact our vision. Then there's electroretinogram, which checks the electrical output. This is a primary test done for retinitis pigmentosa. Then there's fundus examination. That's the picture of the back of the eye. We're actually going to look at that in a minute. Tonometry, where we take eye pressure for cases like glaucoma and ocular hypertension. Sometimes the pressure can actually go too low too, and that can cause some problems like retinal detachments. Then we also want to check color vision and contrast sensitivity. Remember we talked about our cells. Our color vision is something, a job that our cones perform. So if we have problems with color vision, our cones might not be working. Contrast sensitivity is a job of the rod cells. So that's how well our contrast is. We test that usually on a card or images where the letters will stay the same size, but they progressively get lighter and lighter. So they're very, very faint. And as the rods or optic nerve sometimes decreases in function and neural activity, that becomes a little bit more of a challenge. And then of course there's an Amsler grid. Amsler grid is used, it's a basic cross grid, and it's used for macular dysfunction, so people can monitor that at home. So these are just some of the tests. There are some other tests too that your ophthalmologist might do, but these are primarily the tests that we look for. Some of these we do in office here. Some of them we'll refer out. Most people have come with majority of this testing already. If not, then we either have local ophthalmologists that we can refer out to, or of course, you can go to your So this is what the back of your eye looks like. All right. Anybody ever see this picture before? This is when your eye doctor, probably, I don't say about 20 years ago, they went from what's called a ophthalmoscope, where they either had a flip over their eye or they held a little thing. Remember, they kind of turn the lights out and they get up in your face, and you hope they didn't have garlic for lunch, and they're looking in there and checking you out. And now we have HD technology and cameras. So instead of just looking and trying to see what's going on, they can blow up a picture and put it on your computer screen and save it so we can see progressively if there's any changes or anything. So that's what the fundus looks like, and it's really important for progressive diseases. So you guys should have a basic idea of what this is, just so you know, and if you get the pictures, if your doctor ever gives you your pictures, you can compare them and know what you're looking at, kind of. So this is the back of the eye, so it's kind of looking through your pupil. All right, this is what you'll see here. This is called the optic disc here. That's where the optic nerve, the head of the optic nerve pops out, and all the blood vessels that come out. Then we have the macula in this area, which is where all the cone cells are concentrated, and within the macula you have this little super dark circle there called the fovea. That's where the really, really, really high concentration of the cone cells. Your rod cells kind of hang out in the periphery. Again, that's more your contrast vision and your dark light vision, your adaptation, your peripheral vision. Your macula, again, is your cones, and your cones are responsible for your color vision and your HD vision, your real sharp, fine, acute visual acuity. So when we have macular degeneration, we know there's problems with visual acuity or reading or face recognition. Not so much of a problem for other conditions like glaucoma or retinitis pigmentosa, where the central vision's usually upholds pretty well. So ask, when your doctors take pictures, ask them for copies of this so you can see this. And we can look at some conditions and get an idea of what's going on. So for example, this is retinitis pigmentosa. What do you guys see that's different here? Anything? Yeah, see those dark spots there? Yeah. Kind of looks like a forest fire, right? Went through there, and that's pretty accurate analogy, because what our theory is that it's chronic inflammation, all right? And this chronic inflammation causes or can cause an accelerated breakdown of the RPE, retinal pigmentary epithelium, which is the structure in the eye. It breaks down faster than it can regenerate, and it leaves this dark pigmentation, is what it's called, which is kind of like a purpley black color, and that's non-transparent, right? You can't see through that. It's a dark, it's like stained, like ink stain. So it's like you get stained. That's pretty much what happens. So it's not transparent. You can't see through that. Initially they thought these were all just dead retinal cells, but that's not the case, because they found that visual function can improve, and that there's still activity going on with these cells. So it just means that we believe it's just ocular waste. It's just garbage that's accumulating. Either, again, the body's breaking it down faster than it can regenerate, or the detoxification process isn't keeping up. So what that means in real life is you're either having a party, and you had a huge party, and you're creating all this waste, and your garbage is overflowing, or the garbage men are on strike. They're not coming, and they're not taking the garbage out. So whatever the case is, we have a buildup here, and there can be different causes that we're going to get to in a little while. But this is what, and you could see how it affects the peripheral vision, right? This is the macula, which seems pretty clean, but over time it can start to impact that central vision area. And other complications with retinitis pigmentosa too is this area can become inflamed, and you can get macular edema or cysts, called cystoid macular edema, or CME, which is really commonly found. We get really good results with that as well. Now here's something called drusen. Okay, for those of you guys who have macular degeneration or know somebody who have macular degeneration, or what happens here is, what do you guys see here that's a little different? See those little yellow specules over there, little spots? That is called drusen. That's cholesterol, protein, a little bit of calcium buildup. Where else do we see cholesterol build up where we don't want it to? Heart, cardiovascular system, right? Same thing. This is an early detection for cardiovascular disease too. Most of conventional medicine hasn't made this link yet to the link between cardiovascular disease and macular degeneration, but I will tell you that 85 to 90% of my patients who come in with macular degeneration, age-related macular degeneration, have either some cardiovascular disease, meaning their blood pressure is high, or there's some hypertensive medication, or some family history of heart disease or something. There's some cardiovascular issues going on, whether they're having them now or it's in the family. So we know this, right? Because cholesterol is being deposited systemically. So it's going to go everywhere. We know it's starting to congest around the heart and the arteries. It's also going to start around the eye. So the good news is when we start taking care of the eyes to get the drusen down and to control that buildup of cholesterol, we're also protecting the heart. Right? It's the same. And a lot of the supplements that we use to treat macular degeneration are the same things we use for heart health. The diet we recommend is a heart healthy diet, right? Low in trans fats and fast food and garbage and stuff like that. All kinds of junk food. And we want to use supplements like CoQ10 or fish oils or astaxanthin. All these things are heart healthy. They improve heart function. They'll also help benefit the macula in the vascular system. So what happens is this drusen becomes obstructive, right? They get in the way. They're like little pebbles that you can't see through. If it progresses, they're going to start to clog the blood vessels, so the microcapillaries, and it's going to cause starvation to the macula. So the macula is going to start to break down. I'm going to start to get macular degeneration. So you have obstruction, and then you have degeneration as a result of that. So your doctor may tell you early stage that you have some drusen, but you may have perfect vision. Doesn't necessarily mean that you're going to start losing vision. It's progressive. So the goal is when we find this out, the earlier we find this out, prevention. Because once these cells start dying, you can't get them back. So prevention is a much better strategy. That looks ugly. Retinal bleeding happens a lot. This can be wet macular degeneration. This can be diabetic retinopathy, brittle blood vessels. This can be stroke, ocular stroke. So any of these blood vessels that pop cause bleeding like this. The conventional treatment for this is to use injection. It used to be laser therapy, but now we use injections. Avastin, Eylea, Lucentis, where they inject. It helps sop up all the blood. Necessary. It's a little bit risky because it's pretty toxic stuff. They're usually chemotherapy drugs that they use for this, but it's very good at helping to absorb the blood, right? This blood coagulates, turns into pudding. You ever make pudding and stuff? That's hard to clean up. It becomes like as the blood does, it coagulates. It's much easier to get it out while it's still in relatively liquid form. So the Avastin or the injections get in and they help clean all this stuff out. And you want to do that. This is an emergency situation. And if you let the blood sit, you're going to have some problems. Want to talk about cataracts. Cataracts is not something we necessarily treat often exclusively for a couple of reasons. One is that surgery is so successful, so everybody's going to get cataracts at some point. But the reason I want to bring this up is because people with degenerative conditions, macular degeneration, glaucoma, retinitis pigmentosa, Ushers, Stargardts, you're going to get you're going to get cataract probably a lot earlier. Okay? Cataracts develop as a result of oxidative stress and inflammation. Okay? That's what's going on, and we're going to get into this a little bit more with the cause of the diseases, but basically what happens is those conditions are going to accelerate cataracts. All right? So we need to understand that. What is a cataract? A cataract is where the lens becomes opaque. It oxidizes. Your clear window gets dirty. All right? So it's a process called protein cross-linking, and it just progressively gets thicker and thicker and more opaque, and you can't see through it. Now, one point about this is a lot of you guys will probably, at some point, your doctor's like, oh yeah, we should do cataract surgery at some point. Let's wait till it ripens or until your cataract's ready. Now, there is more of a risk with cataract surgery with somebody who has retinal or optic nerve issues. Okay? Why? Because the cataract, although you can't see, is also filtering out or acting as a natural sunglass. It's keeping UV rays out, right? So you got this cataract building. You can't really see out too well, but the UV rays aren't getting in. So it's kind of protecting the retina a little bit in that aspect. You go for a cataract surgery, and they take out the lens and replace it with a clear new window, right, new lens, all of a sudden you have all this UV rays coming in that are going to burn the retina, or at least stress it out. You're going to get sunburn. So one of the biggest things that happen when we have cataract surgery or post-cataract surgery with macular degeneration, retinitis pigmentosa, or some of these conditions, is edema. What happens when you get sunburn on your skin, a really bad sunburn? Blisters, right? You get blisters. The same thing happens on the retina. You get blisters, or that's what edema is. It's fluid that builds up because the heat and the inflammation, the oxidative stress from the UV rays, you know, it's like being inside all winter. You know, for those of us who are, you know, pale, you've been inside, and then it's like in May you decide to go down to the Bahamas, and you forget your sunblock, and you're outside. You're gonna fry, right? Because you haven't been out in the sun for months, especially if you're fair skinned, which these aren't really nerve protected. They're already weakened as it is. So now it's tremendous stress situation. So point is that there are provisions and measures we can take. When we know we're going to go to get cataract surgery, we want to take supplements. There are key nutrients that are going to help support the retina and the optic nerve, protected antioxidants primarily. We want to wear sunglasses. I have so many patients who went through cataract surgery that, you know, and again, it sounds like it should be second nature and common sense to do something, to just put but people just don't think about it. You know, they just, and they'll go to the beach, or I have patients who were out on a boat for a week. You know, oh my God, I came back, my vision's so much worse. That's why. Right? So we want to use UV protected wraparound sunglasses. Really going to help all the time for like at least 6 weeks. Stay inside, and if you're going to go outside, I don't care if it's rain or shine, because do UV rays go through clouds? Yeah. Give me a bobblehead. Yeah, they do. And so it doesn't feel like, oh, well, it's not so sunny out. No, you have to protect your eyes. So I tell people for at least 3 months, okay? Even some windows, you know, older windows aren't UV protected. Don't go out there. What might be a good time of year if you have the option? Winter time, right? Less sun, you're outside less. There's going to be less stress. Well, unless you're in the southern hemisphere, right? Then summer's the perfect time to do it. So you have a lot of patients that come. So yeah, you want to go during the time of year where the UV rays are less. So we're going to be putting more information out on this. We're actually going to do a talk on this, like a podcast, because this is so important. You guys really need to know this. So if any of you guys are getting cataract surgery, or you're about to, your doctor's recommending it, please contact us. Let us know. Again, we're going to have podcasts. We're probably just going to have like a white paper out to, here's like top 5, top 10 things you guys can do, or what you should do before you get cataract surgery. Some real easy preventative stuff just to help to make sure you don't have any complications. So let's get into what causes vision loss. All right. So what causes your vision when you're diagnosed? Glaucoma, macular degeneration, retinitis pigmentosa, any of these conditions, Stargardts, Ushers, bad luck, age, genes, bad genes, maybe. Okay. Genes do play a role. You know, there's genetic predisposition, there's trauma, injury, illness. You can get sick, you can have an accident. Certain drugs and medications can break down the optic nerve. Retina surgeries too. Had patients malpositioned during surgery, came out of it, optic nerves were shot. Medications, people on medications, it can really mess up your retinas. Particularly, I've seen people with inhalers. People have asthma, a lot of puff inhalers. I've seen so many, even 4-year-old kids. And I don't know if these people are genetically set up but I've seen so many cases specifically where steroid inhalers and nebulizing has done tremendous damage to the macula. Now, should you go out and just not nebulize your kid or yourself if you're having an asthma attack? No, because you could die, and death is not good. So, it's not, we don't want to be dead. So we need to do that, but keep in mind that there are tendencies. Some people, if you have a tendency or you have family history of retinal disease or macular degeneration, you can get that. You can definitely get usually macular edema or some type of macular degeneration. I've seen it. It's not documented, but I've seen so many clinical cases from little kids to teenagers, their 20s or 30s. There's a major link there. Again, metabolic imbalances like diabetes we talked about. We all know that can impact vision. Epigenetic stress factors. What's epigenetics? Epigenetics is your lifestyle and environmental factors. Okay? Environment is UV rays, pollution, food, GMOs, pesticides, stuff like that. Also internally, epigenetics, also your emotional tendencies, which we're going to get into in a little while as well. And then also any other systemic disease. All right, just systemic disease can impact the vision. So from our perspective, from a holistic, naturopathic, functional medicine, integrative perspective, there are three major factors that will drive your vision loss or neurodegeneration. This can be pertain to brain as well. Okay? Poor blood flow. Talked about all the cells need oxygen, they need food, and they need detoxification. Circulation is very vital to life. We have to have it. Oxidative stress. Everybody know what oxidative stress is? You kind of heard about antioxidants. Everybody knows what antioxidants are usually nutrients that combat oxidative stress. Oxidative stress is accelerated aging. It's rusting. It's a normal process, but in these disease processes, not only retinal diseases, but things like Alzheimer's, Parkinson's, MS, any neurodegenerative condition, oxidative stress plays a major role in accelerated degeneration, and it's definitely linked to most of these conditions. Now, we need to figure out what's driving the oxidative stress. But very, very important. And the way we usually deal with oxidative stress is through nutritional therapies and diet and reducing factors environmentally and nutritionally that can accelerate oxidative stress, like UV radiation, right? Inflammation is the third major factor. Inflammation not only will accelerate oxidative stress, impair blood flow because it causes, the blood vessels swell and we're going to have blood circulation problems, but it's a fire. There's only so much heat that a cell can tolerate before it dies. Nerve cells aren't very, they don't like inflammation very well. They're not very well insulated against, they don't have a cooling system, an effective cooling system that can help them deal with inflammation. So these are really, really, really important for us to understand. Okay? Three things: poor circulation, oxidative stress, accelerated oxidative stress, and inflammation. We have to identify these three things and start to control them before we have any ability to start to control or improve or even suspend the degenerative process. We have to deal with these three things or we're not going to make any difference or any benefits. All of them. You can increase circulation, but if the oxidative stress is driving and inflammation's still there, it's not going to help too much. You can reduce the inflammation, but if you don't improve blood flow, it's not going to help. You can improve the oxidative stress, which could help, but then if you're not getting the vital nutrients to the eyes and brain, so we really need to look at all three. Does that make sense? We're good? Okay. All right. So what happens is these three factors, circulation, inflammation, oxidative stress, will promote a toxic environment. All right? That'll promote metabolic acidosis. It'll drive the oxygen levels down in the body, increase the carbon dioxide levels in the body. What does that sound like? Global warming. Think about it. A lot of these conditions were, from Chinese medical and naturopathic perspective, we're not disconnected from our environment. So a lot of the diseases that we could suggest that our planet is seeing could be impacting us, animals, and all of life. Right? So a lot of these conditions can be impacting us and are impacting us. So we need to be attuned to those. So we're more susceptible to chronic infections. Our immune systems decline, right? When we have chronic inflammation, it stresses our immune system. We age faster, right? Oxidation, where do we see that? Where does that show up? Where's the most common place we start to see oxidative stress? Skin. Right? I don't care if it's a person, an animal, or a plant. Plants wither. People look more distinguished. Is that a nicer way to say aging? Happy lines, stuff like that. So, but that's what happens, right? You look at a little baby or a young child, the skin is so soft and squishy and, pliable and malleable, and it's like they're all water. They're not oxidized. Look at any baby animal or a sapling or something like that. It's all flexible and it's got this turgor pressure in the cells and, really vibrant colors. And as they age, it starts to decay. And then you see as plants and trees and bushes start to go and they're, nearing either the end of their life, either from environment or stuff, they start to wilt, they dry out, they get crunchy. That's oxidative stress. They rust. So we also become more susceptible to autoimmune diseases. Autoimmune diseases are where our body's immune system turns on itself. It starts to attack. Instead of attacking viruses, bacteria, fungus, or any other disease, pathogens, or microbes, it identifies our own tissue and thinks it's an enemy. Thyroid is real common. MS, we know, in the nervous system. We see it in the skin, psoriasis, eczema. A lot of the ocular conditions too. Retinitis pigmentosa, Stargardts, Ushers, a lot of glaucoma cases, uveitis, iritis. Large probable autoimmune component to these. Conventional medicine doesn't have a good strategy for that, for dealing with this. We do. Also, metabolic wastes accumulate because the detoxification pathways become impaired, right? The system starts breaking down. There's just garbage starts building up. And then we have more environmental toxins that can add to that, which we deal with on a daily basis. Just heavy metal toxicity, environmental pollution from cars, smog, pesticides, pollution, chemical, hormones, GMOs, antibiotics, steroids, in the water, in the food, in the air. Look, you can't escape that stuff, right? We talked about things we can help and things we can't help. Don't stress about that stuff. Try to eat a clean diet, which we're going to talk about. But you can't, what are you going to walk around like Darth Vader with, you can't, that's not practical. You got to go up to, the Alps or something like that. You want to, live up in British Columbia, that's great, but most of us aren't going to do that or can't do that. It's just not a viable option. So what we want to do is make sure our bodies are relatively clean, our liver and our kidneys, which are primarily used for detox, are working. So our body can get rid of all the garbage that we put into our body intentionally or non-intentionally. This is really important, all right? This is where everything that comes together in terms of what we can do and what we can't do. And this is how acupuncture and a lot of the alternative therapies work. And this is where the mystery of holistic, airy-fairy, new agey music, I'm waiting for a cue for the whale songs or something like that. No, but seriously, this is where we've taken this esoteric, abstract concept of acupuncture or energy work or whatever you want to call it and really rooted it. And we're doing the research like we showed you, but this shows a lot in terms of benefiting neurodegenerative conditions, in this case particularly eye diseases. So we have normal photoreceptors, right? Normal nerve cells. They function, right? What's their job? Pick up light, turn it into electrical impulses, send it to the brain for interpretation, right? The cameras. Working, we're seeing, we're happy. Then we start to have dormant nerve cells, all right? Something happens, they start to shut down. They go to sleep. Maybe oxygen deprivation, maybe starvation. They're kind of going into hibernation, maybe a comatose state. They're not dead. The structural integrity is there. It's like your cell phone. It works. You just got to charge it. You just plug it in. It's totally, all the parts are there. Everything's where you didn't drop it, you know, flush down the toilet or anything. The structure is there. It works. It just needs a little charge. Then we have the damaged or abnormal nerve cells, okay? Those have been mutated, either damaged structurally, they're kind of hanging on, they're sick, they're not really working too well, the structure's not so hot, the function's not so working so well, but they're not dead. They're sick, right? Kind of think of yourself like when you got a flu. You're just not productive. You're just not well, you're not dead, but don't try to ask me for anything, or don't have a conversation with me, or don't want to check your emails. You're just like, you know, you're not feeling so hot. So, then we have our fourth level, okay? That's dead scar tissue fibrosis. What do we know about dead scar tissue or dead nerve cells?
They're not coming back.
They're not coming back, right? They're not coming back. Why do I have a line there?
The top we can fix.
The top we can fix. Fantastic. You guys are smart. Yes, that's why I put a line there. From here on up, we can do stuff with, okay? But dormant and damaged, when you do like an OCT, or an ERG, or you do a visual field test, a functional visual test, whether it's kinetic or dynamic, these cells are sleeping. They're going to look like they're not functioning, but you can't look at two cells or look at an effect or a function of two cells, try to read out a function and say, well, this one isn't functioning, and therefore the assumption has been that it's been dead. All right? That's not the case. Finally, a year ago is the first time I finally saw literature on cell dormancy. They're getting it. We've been talking about cell dormancy for, Chinese medicine is talking about it for, you know, thousands of years. Different terminology, but it's the same concept. We've been talking about this, but I learned about this about 10 years ago, dormancy, from one of my teachers and good friends who's very big into brain neurodegeneration. So this concept of dormancy is huge and it has a lot of applications. This is where people see better after treatment. Acupuncture, which we're going to get to in a couple minutes, one of the things it does is it stimulates the dormant cells. Okay? Magic. It's not magic. Dormant cells wake up. How do they wake up? We're going to talk about that. These damaged cells, you can nurse them back to health. You can. You can heal. That's healing, right? Dead is dead. So after we finish treatment, whatever we've determined is dead, you're not getting back. But that doesn't mean that you know, everything's over and done with, because we have science and we'll get to that. But do you guys get this? Does this make sense? If this is the eye and these are, you know, all the cells, we have those that function, those that may be sleeping, that can be woken up, and then we have those that need to be and can be nursed back to health. But then we have a ratio or a percentage that's going to be shot. We want to keep alive, functioning, and well. We want to minimize death, right? We're on agreement?
Yeah.
Death, not good. Life, good? Yeah, good? Okay, good. Bobblehead, good? Okay. All right. All right. Real quickly, we're going to talk about just the difference in philosophy and approach. This isn't like kind of a, you know, I'm not, there's a lot of holistic integrative practitioners who are very anti-conventional medicine. There's a lot of conventional medicine that's anti-holistic medicine. We're integrative. It's use what is necessary when it's necessary. You know, use conventional medicine when appropriate. I get into a car accident, God forbid, or something happens, I don't want acupuncture. Stitch me up. put me back together. You know, if I need a blood transfusion, give me, you know, just whatever I got to do to get me from not dying. Then with rehab, maybe. But on the flip side, if I have, you know, some chronic degenerative disease that isn't, don't play guinea pig with steroids and anti-inflammatories and drugs that, you know, could be very harmful, or even, you know, you guys see the side effects on TV. Could cause death. You know, that's a bad side effect. So, philosophical approaches, conventional medicine. In ophthalmology, the eye is usually diagnosed and treated as an isolated organ pathology. What does that mean? They're just looking at your eyes. There's not like a systemic evaluation. They're not looking at blood work. They're not looking at, you know, oh, well, this cardiovascular with macular degeneration maybe have a correlation to your heart disease. It's just not, you know, go to your cardiologist if you're going to deal with that. But it's important. Then it's also said that the decline of vision is usually said to be a natural process if it's age-related. You know, you're getting old. It's either going to stabilize, maybe, if you're lucky, or it's going to get worse. That's it. Conventional treatment. What do we do about it? Okay, you go to your doctor, what can you do? Well, we can give you glasses, you know, if you're nearsighted or farsighted. If you don't want glasses, you can wear contacts if you don't like how glasses. And you can get a lot of different kind of glasses now. You know, they're really styling. Medications. You have glaucoma. You can get eye drops that'll help reduce your pressure. If you have an infection, you can take antibiotic eye drops. Okay? If you have some weird inflammation going on, you could take steroids that'll help. You can take drops for dry eyes that may benefit. So there are medications that you can take that'll help. Then there's surgical procedures. Okay, we have surgeries. Usually, if there's, say, a detached retina, right? Got to put that back together. Got to reattach it so it can, you know, try to heal as best of the ability. We also have glaucoma, which is one of the biggest areas of ophthalmology where surgery is used, primarily to try to deal with reducing eye pressure. All right, so we're going to have things like trabeculectomies. We're going to have our laser procedures. We're going to have all kinds of things to try to reduce the eye pressure. Often they make things worse. There's a lot of scar tissue, there's a lot of damage, they're thermal lasers, so sometimes it helps, sometimes it doesn't. With glaucoma, we know that there are other factors too, that managing pressure isn't enough because people are on medications and they're taking eye drops to lower their pressures are all good, 9, 10, 11, but they're still losing vision. Why? Why? Who can give me 3 reasons why? Circulation, oxidative stress, inflammation, right? Those are factors that drive neurodegeneration. Conventional medicine doesn't deal with that, all right? So yes, use conventional medicine to keep the pressure down. That's what the glaucoma specialists do. But we got to deal with other things, neuroprotection. Or there's no surgery, no drugs, no corrective lenses. Sorry, just got to wait, see, maybe some research, maybe stem cells, maybe gene therapy. See what happens. Just kind of, you know, get used to it. It's not a good option. I'm not on that. You guys, no, not. But for some people, you know, that's fine. If some people are just okay with it, which some people are, that's, you know, but we're here to help educate people who are not okay with it, who are told that there's nothing you could do and you just got to wait and see if there's anything. That's not the case. This is showing you that there's a lot that can be done. All right? So now we go to the holistic medical approach. This deals with the body as a whole, not individual parts. Right? You have eyes that are attached to a body. Right? It's not just eyes. We need to, yes, we want to help your eyes. We want to help improve your vision. That's why you're here. But we need to understand what's going on with your eyes as it relates to your whole body. Are there autoimmune processes, inflammatory processes, nutritional deficiencies? What's going on that's driving this degenerative process? It's not just some unknown cause. There are always causes. There's always something that's driving this process. We may not know exactly what it is all the time, but we can get a pretty good gauge of it. And we can do things, we can set up structures to help at least slow the progress. So again, everything is connected, and vision can be influenced by all organ systems of the body. The cardiovascular system, hepatic system, liver, kidney detoxification systems, immune system, lymphatic system. It's all going to play a role in your vision. If one gets messed up or sick, or there's a problem with one system or your immune system, sure it can impact your vision. Circulatory system, sure it can impact your vision. So we really say this is a holistic approach, holistic integrative approach, because we're not excluding or shunting or trying to tell everybody how horrible conventional medicine is. But it has a limit. There's only so much it can do. In some cases, nothing. So just when your doctor says, your retinal specialist, whatever, says, look, there's nothing we can do, what you have to realize, what they're saying is there's no drug, there's no surgery. That means within our box of drugs and surgery, there's nothing we can offer. That doesn't mean there's nothing in this entire world that can help you. It's just that as at this point in time, there's no drugs or no surgery. Talk about acupuncture. A lot of people are really afraid of acupuncture, afraid of needles because they confuse hypodermic needles with acupuncture needles. This is a hypodermic needle. These are acupuncture needles. That's a lot of needles you can fit into the head of a little hypodermic needle. It's generally not, it's not like a shot where you get, or when you get blood drawn. It's not that experience that people have. Is it asensational? No, you don't not feel it. The laser acupuncture you don't feel, but it's kind of like a mosquito bite. Some people say is like a dull ache. Depends on where the points are that we're using. Sometimes you really don't feel much of it going on, just like a little tap around the area. Other areas are maybe a little bit more sensitive, but we have 4-year-olds to 104-year-olds that I've treated. Most people's experience with the fear around acupuncture is just a fear of needles based on when they were kids going to get a shot or a booster or a vaccination or something like that. So we understand people do have these issues, and we'll get into alternatives that we created for people who just absolutely, it's not even on the table that they're going to go for acupuncture. But most people, once they kind of get it out of their heads or they experience it, it's really not that big of a deal, especially when we see the potential benefits of increasing circulation and how well it can work. So in terms of ophthalmic acupuncture, so as we know, acupuncture is approximately 3,000 to 4,000 years old. We don't know exactly, but it's old. Originated in China. It's the insertion of needles into specific points of the body to get the brain to increase blood flow, regulate autonomic systems, get organs to regulate, self-regulate. If they're hyperactive, get them to slow down. If they're tired and lazy, get them to speed up, kind of build them up a little bit. So acupuncture is very regulatory, and each acupuncture point has a specific function. So there's different acupuncture points that you can put in that'll affect, say, your sinuses. And there's some acupuncture points that'll affect your digestive system. And there's points that'll affect your vision. So the question that we get all the time is, how do you know which point goes for what? That's why we go to school. You learn. It's like coding, all right? Not unlike your circuit breaker in your house. Right? In the basement, we have a nice circuit breaker, and you have all the switches that flip on your kitchen and your garage and your basement and your dining room and your living room. That's the same thing. So with acupuncture, we're flipping switches which are going to send signals to your brain to get blood flow going to your eyes, or regulate your thyroid, or help increase blood flow to your head because you're getting migraine headaches or something like that. So that's what acupuncture is doing. What we found is there are certain systems. Okay, let me back up for a minute. So acupuncture, in the thousands of years it's been around, there's been so many branches and styles and systems and techniques created, all right? There's Korean acupuncture, Japanese acupuncture, French acupuncture, German acupuncture, Chinese acupuncture, American acupuncture, the list goes on. So what we've done, or what I've done, is spent a lot of time looking at a lot of these different systems, and they're all good. They all have benefits for different types of diseases and different types of conditions. But what we wanted to do is find out which systems, acupuncture systems, will get the best results for eye conditions. Why? Because that's what I do, right? So we found that there's specific acupuncture points, and there are some particular acupuncture systems that seem to have the best effect on eye diseases or visual. So we've tried these. We tried this system, and if it didn't really show good results, or I didn't see much improvement, or a patient didn't report, don't use it anymore. Not that it's not a good system, it's just not necessarily the best for eye conditions. So some of the systems that we found to be very beneficial are microacupuncture, electroacupuncture, which is what our research was based on, specifically for retinitis pigmentosa, some of these real difficult eye conditions. Laser acupuncture, which is where we use laser diodes on acupuncture points. It's needle free. This is great, again, for people who are needle phobic. It's great for kids. I originally started using this in kids because I had a lot of little kids with Stargardts, retinitis pigmentosa, optic nerve atrophy, and they wouldn't take the needles. So we're trying to figure out ways to stimulate the acupuncture points without without upsetting them, make it a better experience. Who doesn't like kids mad at you? Nobody wants it, It's not fun, I love all my patients. I don't want a kid cry, So anyway, certain ear acupuncture systems were shown to be beneficial, particularly German acupuncture. There's a whole system of where we do ear acupuncture. Traditional Chinese acupuncture, we're discovering certain points to be more effective than others. Traditional Japanese acupuncture, same type of thing. They're really rooted in the classics. They can get certainly very good benefit for certain conditions. Korean hand acupuncture has a really good benefit as well for certain conditions. So the job, or the education in terms of the practitioner, myself and my students, is that we want to teach which systems we want to use when. And if one doesn't work for somebody, we got a backup. We can try something else. Because not everybody's going to respond to each of these systems. So we need to know, okay, well, generally what conditions, like microacupuncture, are two systems that I really love for retinal and optic nerve conditions. Retinitis pigmentosa, macular degeneration, glaucoma. Awesome, really good. Not as much for like anterior or like scleritis or iritis or inflammatory, not that effective. More retinal and posterior degenerative conditions. Laser acupuncture, fantastic, just across the board. Some people respond really well to it, some people don't. It's trial and error. And the other systems as well. So again, the goal is to continue to try to figure out which systems work best, and that's kind of a work in progress. How does acupuncture work? All right, everybody asks. It's acupuncture, you put needles. Before we started doing these talks, you come get acupuncture, your vision gets better, go back. Oh, my vision got better. Acupuncture. How's it work? What do you mean? Put needles in. Just put needles in, my vision got better. Sounds like magic, So we need to educate you guys so you can understand. You can talk to your doctors, you can talk to your family members, why we're again providing this education to create education and an understanding and a mechanism of action. So we know acupuncture increases blood flow with the eyes, to the eyes, which again will increase carbon dioxide, helps the delivery of vital nutrients, food, and toxins. Increasing blood flow. Where do we remember that from? right? One of our 3 key factors. We need to get the blood flow. Acupuncture is the best thing available to get the blood flow to the eyes. We've checked it with ocular Doppler. That's a machine or a device that measures blood flow. Check it before, put some needles in specific key acupuncture points. We have seen a clear, measurable improvement in blood flow to the eye. We need that. Acupuncture also helps to control inflammation. Number 2, inflammation, right? You know, that is something we need to control. That's going to accelerate our vision loss. It also stimulates the vision pathways in the visual cortex, helps the brain to see better. It stimulates, it wakes up the dormant nerve cells, right? So you got one cell sleeping, one cell's dead. How do you know? Looking at them, checking function? No. You're going to check, you know, analogy is 2 people, right? One's in a coma, one's sleeping. Can you tell, can you measure their function? No function. Sleeping person's not going to be functioning. Person in a coma is not functioning, right? It's not an accurate measurement. How do you tell? You have to provide a stimulus. 2 people. Air horn. Bucket of water. Loud noise. Scream, you know. Wake them up. You know, provide a stimulus. You know, siren, something. So nerves will respond to stimulus. So that's what the acupuncture does. It's a form of stimulus that doesn't have side effects. It wakes them up, right? It's like doing CPR for the eyes, for the retinal cells. Just shocks them, wakes them up, you know, gets them back into action. When we have that, so those will start to wake up. And what will happen to the ones that are dead? They don't. So now we know. And guess what? The degree, if somebody has a really big improvement, you know, are they lying? No. Is there a mechanism? Yes. It means they have a lot of dormant cells that were sleeping that woke up. If somebody doesn't have is a dramatic response, they're probably going to have more dead cells or more cells that are sick that take a little bit longer time to recover, right? So it's not magic. So what's funny is during the research too, they were doing the stem cells and everything. We'll talk a little about this later. Is they were actually doing research and in the research process, we're stimulating the nerve cells, and people's vision were getting better. And they're like, oh, they couldn't figure out what was going on, why people's vision were improved. This is why, which I think is what prompted the recent investigation into cell dormancy. Also regulates the autonomic nervous system, right? That's your fight or flight, your stress response. You guys notice? You get a little more sleepy during treatment. Afterwards, you need to sleep. You know, you don't have the get up and go necessarily, not running around. You may feel a little bit more relaxed because acupuncture activates the parasympathetic nervous system, which is the recovery response. That's where you regenerate and you heal. The sympathetic nervous response is the opposite, is your fight or flight, your stress response, which most of us live in most of the day, especially if you're like in the Northeast. You know, if you're like down in, you know, somewhere a little bit more relaxed, not as close to major cities, you're going to see more of that, more sympathetic, right? So we need to activate that healing process. So people, oh, why am I so tired? I don't have the energy. Great. You know, what do you mean great? I just told you I'm exhausted. No, it means that you're, well, I don't want to sleep more. I don't have time to sleep. Well, that's how your body's regenerating. So again, we promote the parasympathetic healing response, deactivate the sympathetic nervous response to facilitate healing. You can't heal when you're stressed. We're not wired like that. We're either in a recovery process or we're stressing out, working, fight or flight, problem solving. And most importantly, we're treating your eyes and the underlying condition. All right? We have to identify what's going on in most probability and identify the underlying cause and deal with that. We're not going to do, you know, you could do acupuncture points or any treatment, microcurrent, eye exercises, energy work, whatever you want to do for your eyes. But if you're not have at least a basic understanding of what's going on, at least some probability of what's going on that's causing this, and you're not dealing with that, you know, it's not really going to help that much. Again, it's like we talked, you can do things to improve the blood flow, but if you don't deal with the oxidative stress and the inflammation, you know, it'll last short term. So now I want to talk a little bit about the program, just so you guys understand a little bit more how it works. Generally, when people come in, we recommend an initial week or 2 weeks of intensive treatment. First patients, we usually recommend 2 weeks, and I'll explain why in a minute. The reason we recommend intensive treatments initially is a couple of reasons. One is because a lot of our patients come from out of the area, so we want to try to see, we need to maximize the time they're spent here. We found that the shortest time we can see an improvement is about 5 days. Some people will see an improvement after 2 days, 3 days, even 1 day sometimes, but we need a week. I need 5 days of treatment twice a day to see if you're going to respond most of the time. So what we'll do is an initial series of 10 treatments. We'll do acupuncture twice a day, usually about a half hour with an hour break in between. During the hour break in between, people usually rest, relax, go get a bite to eat or something. And then again, we'll do our testing before we start, do our treatment for 5 days, then we're going to retest. Testing is critical. Why? Objective results. It's great if you guys say you think you see improvements, but again, the brain sees. If your eyes haven't been working or kind of, excuse me, if your eyes have been functioning a certain way and not seeing to the best of their ability, your brain is doing the seeing, and it's been kind of wired to see that way. It's adapted, in other words. So when the eyes start to pick up new information, some people, their brain picks it up automatically, and you see subjective improvements. Other people, the eyes start to pick up the information and see better, but the neural tracts have been there for so long because you've been seeing a certain way that your brain is just used to seeing that way. So although you see better, the brain needs a little bit of time to catch up. So that's why we want to not solely rely on your subjective feedback. We want objective, measurable responses. That means, are you seeing better? Are you not? Are your acuity? Are you reading better? Your visual fields improved. Adaptation, contrast, night vision. Are your color vision better? All these tests. Then we could go back afterwards and go to your ophthalmologist and do things like OCT tests or fundus examinations. We'll also check your tonometry, right? Acupuncture in some cases can improve eye pressure, so we want to monitor that. So in addition to the acupuncture treatments, we usually recommend supplements. Why? Because the supplements are the fuel that are going to feed your starving retinal cells and optic nerve. Remember, there's inflammation, oxidative stress, and poor circulation going on. So we want to dilate the blood vessels, increase the blood flow with the acupuncture, and then pump all these vital nutrients to your eyes. Feed them, right? They've been choked off, no oxygen, and starving. So now they can breathe, and you're feeding them. This is how we nurse them back to health. So the combination of the feeding and the breathing and this neurostimulation will revitalize the vision in most cases. After we do the 1 or 2 weeks of treatment, we'll sit down and go over your results and then go over a home care plan. What do we want you to do for follow-up? Do we want to continue? When do we want to continue treatment? When do we want you back? If you can't come back, what are our alternative strategies? Can we find an acupuncturist near you who can help follow up with some of the treatment? Lifestyle, vitamins, supplements, diet, all the other stuff we're going to go over in a little while. So we want to look at all that. So it's a whole program, and we really want to try to get whatever we can done and respect that people are traveling from a very long distance. In certain cases, patients come from all over the world. Every week, we have different patients. It's amazing. And they keep coming back. Why? Because it works, and they know that it's helping preserve their vision. So there are different phases of treatment that's important for everybody to understand. So the initial stages when you're here getting your treatment is called the recharge and recover. That's what I call it. Again, we're arousing the dormant cells. We're increasing the blood flow. We're getting nutrients to the eyes and feeding the starving cells. So we're going to wake up those dormant cells, right? Remember we were just talking about that a little while ago? The cells are starting to sleep. Wake them up. If we have relatively few dormant cells, vision may not be so much improvement, a little bit. We have a lot of dormant cells. Whoa! People, I can't believe I see these people getting their driver's license back. People are just, I can see your face, I can read all these seemingly miraculous responses that people have that have gone unexplained and misunderstood by a lot of people. Is, oh, how can that happen? It's, quackery and this and that. No, it's easy. Increasing blood flow, getting oxygen, getting food, stimulating dormant cells. That's how we see better. It's very possible. Cells aren't dead. You can't measure live or dead cells strictly by functioning or observation, by looking at them. You have to test them, provide a stimulus, see if they respond, nurse them back to health. Which leads us to the second phase, the repair and regenerate. Generally, the first year of treatment is really important, okay? Around 8 to 15 months, the cells will regenerate, the sick cells, all right? So we had our normal cells, our dormant cells, now we're talking about our sick cells. During a year, give or take, maybe 6 months for some people, other people can take up to 2 years. This is when those sick cells will be nursed back to health. How do we know that? How do we know that cells can be nursed back to health? Because when people finish their treatments and they come back a couple months later, they're seeing better than when they left. How is that possible? It's magic. No. What's happening is the sick cells are starting to regenerate. We're bringing them back to life. They're healing. They're recovering. They're functioning better. So there's going to be a slower progress. It's going to be slow. It's not like when you cut your hair, cut your nails, and it's a relatively rapid regrowth. Nerve cells, they thought it was like 40 or 50 years ago that they never regenerated, or they never could recover from injury or illness. They can. It's slow, but they will. So we know that we can get them back to health. After about a year, generally, we say whatever we've recovered, we can recover. The cells that we've stimulated out of dormancy, that are woken up, are functioning. The cells that were sick, most of them are most likely healed or nursed back to health, provided we're keeping up with our strategies, diet, nutrition, acupuncture, whatever. So we shift then to maintenance care. Maintenance care is simply stated, help you keep what you got. Critical, right?
Yes.
People, I don't think it's helping anymore. That's the toughest, and I hate to use the word sell, but education is a better term. But convincing, I came in the first couple years, it was getting better, the first year or two, and then it just wasn't getting better anymore. Right. Because you've maximized whatever benefits you can achieve from acupuncture. But we've got to help you keep what you got now. This is long-term maintenance, and we can work it out. Some people can come more frequent than others, or everybody's different, and everybody's in different financial situations, and some people, it's very difficult to come from South Africa or Australia or China, or New Zealand or Russia. It's a far trip. Brazil. So it's a long trip, So what we want to do is we try to give you guys some homework, some things you could do at home that will help maintain, and that's really my biggest work right now. I know not everybody can get here. I know it's difficult. I know it's expensive, but first we want to see if you respond, and I need to get to learn your case. Once I get your case, then let's figure out what you can do and what you can't do, and then based on that, what you have available to you as far as resource, supplements, acupuncturists, nutritionists, naturopaths. What do we have that we can work with that can help you preserve your vision? I'd love to be able to create a complete home care package that everybody could do, but it's not really realistic. There needs to be some type of intervention, or not. There's some stuff we're researching, so I think we may have some things that are starting to come up that'll allow people to be able to do more themselves. So which is what we want. We want you guys to be able to make it as cost effective, but you got to keep the consistency. My patients who stop because they're not seeing results or they just fall out of care or whatever, it's tough, because then we go from those cells that are sick or dormant to dead. Can't do anything once they're shot. Somebody with the visional tank, I'm seeing them for 3, 4, 5, 7 years, and they come back. Oh, I know I should have been taking my herbs, and I should have been back, and my vision's so much worse. And it's a lot of the times there's not that much I can do. We could try to recover whatever we can, see if there's some dormancy and some sick. We're kind of back to the drawing board again. So again, that's kind of my thing. Maintenance is like this. It's like changing your oil in your car, right? You buy a car. You don't have to like the fact that you have to bring your car in for servicing or change your oil, but you gotta. If you don't, you may just be driving at 50,000 miles and your engine's just going to seize on you, or worse. You could get into an accident. It's like going to the dentist, right? One of my best friends is a dentist. He says, you only got to take care of the teeth that you want to keep. Not all. You have to take care of all your teeth, just the ones you want to keep. But seriously, that applies. There are things in life that require maintenance. We have to take care of ourselves. These degenerative conditions that we have, RP, Stargardts, Macular Degeneration, Glaucoma, you're in a situation where we have uncontrollable what? Oxidative stress, inflammation, impaired blood flow. Your body cannot regulate these processes anymore without help. Supplements, acupuncture, diet, nutrition, exercise, whatever we're going to talk about or whatever we recommend, you need help. You know what I mean? Your body can't do it itself. That's what we call neurodegeneration, or these types of conditions. So you have to. And I wish it was a one-shot deal. I would love to, but due to the nature of what's going on, neurodegeneration, we need maintenance. We need to step in. We need to get the nutrients. We need to reevaluate to see what's going on. Was there an episode? Did you get sick? Did you get stressed? What happened that caused the decline? We need to deal with that. So then again, we talk about maintenance home care. Again, this is towards the end. Things that will come up are nutritional supplementation, diet modifications for the better. Microcurrent stimulation, we recommend for some people. Proper rest and restorative sleep. A lot of people just don't get the sleep they need. Remember we talked about that parasympathetic response? You got to sleep. A lot of people take Ambien. Couple glasses of wine. You're passing out. You're not sleeping. Difference. Regular aerobic exercise. Got to exercise. Core training, core strengthening, resistance. There's in Chinese medicine we call yin exercise and yang exercise, or hard exercise, martial arts, weight training, running, and you have soft exercise, meditation, yoga, tai chi, anything that's more strengthening the connective tissue or relaxing the body. Managing emotional stress, right? Some people, whether it's your vision or you're just dealing with other stuff, or you generally run like a type A, You're just more sensitive to stress. We got to look at that if that's a factor. In many cases, food allergy testing we'll talk about, because food allergies are what? Pro-inflammatory and mess with your immune system, especially if you have a condition like RP or glaucoma where the immune system may be involved. We don't want the immune system to be inflamed, because that's going to pour gas on the fire and accelerate your condition. So what do we see? Again, we talked about a lot of the conditions. We see a lot of macular degeneration, both wet and dry. Stargardt's disease, which is juvenile macular degeneration, genetic. Glaucoma in its different forms. Retinitis pigmentosa, Usher syndrome, which is retinitis pigmentosa with the added benefit of hearing loss. So these people usually early on in life have a hearing impairment, and then later on in life, usually in teens or 20s, they start to develop retinitis pigmentosa. A lot of patients I work with Usher's. Optic neuritis, usually from multiple sclerosis. Optic nerve atrophy, diabetic retinopathy, dry eyes, retinal detachments, retinal occlusions, which is a clogged pipe in the eye, uveitis, iritis, usually autoimmune, ischemic neuropathies, eye strokes, retinal dystrophies, and cataracts, which we talked about. Okay. I have tape on my shoe, so I'm going to pull it off. Get off. Okay, so stress and vision. This is something I decided to put into the talk because it's really, 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 really important. Really. Stress will take you out, all right, if it's not managed appropriately. Everybody has stress. It will accelerate your vision loss if you're not dealing with it. And there's different forms of stress that we're going to get into. We have internal and external stress. Okay, what's the difference? Internal stress, your emotions, and mental stress, right? Mental stress, just problem solving. Not much of emotion, more like students, a lot of lawyers, or just case managing and just problem solving. Then we have external stress, environmental stuff, UV radiation, pollution, all the stuff we talked about, GMOs, medications, anything in our environment, temperature, weather, stuff like that, molds, diseases, microbes. So when we have emotional stress, primarily, or a chemical stress, or some type of a stress on the body, that elicits what we said is a sympathetic stress response, right? That's our fight or flight, okay? So our body decides that we're in a situation, and we're wired originally to have this restorative response where we recover and to deal with stress, right? So fight or flight, sympathetic, is for survival. Fight, saber-toothed tigers, gonna fight them, grab a spear, when we're cavemen, or I don't want to be eaten, I'm gonna run away, I see a cave, I want to get out of here. Fight or flight, get out of here, do something so I survive, okay? There's also the fright. I found the third. Fight or flight is also fright. What happens to the guy who gets fright? Deer in the headlights, he's catnip. So, he gets eaten by the saber-toothed tiger. So, fright's not the best stress response, Fight, you're in there, you have a fighting chance. Flight, you're up a tree, you're in, try to hightail it out of there. But fright's like, he's not so good. But anyway, when we get stressed, it alters our brain chemistry and prepares us for survival, right? Our digestive system shuts down. We get adrenaline coursing through our bodies, cortisol, catecholamines. It's all these things that make us strong, make us able to physically perform to deal with a physical stress. Now, the problem is that we're no longer in caves or dealing with that anymore, but we get fights with our spouse, we have jobs, we have the internets, we're bombarded with stress all the time. So we could be like sitting in our office where there's no life-threatening situations, but have a perception of elevated or sympathetic stress response from our perceptions in dealing with people and work and all our stuff, just our lifestyles. So that we're not designed to deal with chronic stress, is what I'm trying to say. We're supposed to have a major stress episode. If we survived, recover from it. You know, most animals would deal with that. This long-term, prolonged stress, over the millions of years, our bodies has not yet adapted as technology and the stresses have adapted. So it's hard for us as humans. You know, we got to deal with a lot of stuff. Our brains haven't really developed coping mechanisms, which is why there's, you know, really big issues with suicide, drug addiction, alcoholism, depression, anxiety, you know, a lot of these things. So it really messes up the constant flooding of these chemicals and hormones into our bloodstream causes degenerative neurodegeneration and breakdown. Okay, we talked about vasoconstriction reduces blood flow. We would say that's important. We need blood flow, right? Causes inflammatory processes. We know inflammation, not good. Accelerates oxidative stress and acidosis, right? We get a lot more acid production when we get under stress. All those factors, as we know, accelerate degeneration. High stress really just impairs the entire regeneration recovery process. It hampers it because we're not in it. We're not in the parasympathetic response. And you know what? So many of us get stuck in sympathetic stress. Just can't get out of it. You know, maybe you guys have had that at some point, or you know somebody who's just like, I just can't relax. You know, whether you're a workaholic or you're just keyed up from so much going on, or you know, you just can't, you can't sleep, you can't relax, your whole system just can't unwind. So that whole process, that feedback loop to shut down the stress response, basically just, you know, it's like a monkey wrench gets thrown in there. It just will not shut off by itself, and things are going to accelerate. So here's a little drawing or concept that I wanted to share. I took a bunch of different pieces here. The perception of Yi Ling Qi, which is a Chinese phrase that I learned from my Kung Fu teacher. And this other part with me versus it, I take from my good friend Mark Grossman, who I teach with periodically. So here's the thing. Perception, Yi Ling Qi. Yi means intention. I'm probably really destroying the pronunciation in Chinese too, by the way. But anyway, Yi is intention, or your thought process. Ling means to lead, and Qi is energy. So what that means is whatever we focus on, whatever we focus our energy on, magnifies. Our mind moves in the direction of its dominant thought. Okay, our intention leads our energy, or what we focus on. So that means whatever we put our attention on, or whatever our mind is on, is going to magnify. Okay, that's where our energy is going to go. So generally in life, when things are okay, we have me, or you, or this person, and we have our things that we have to deal with that are, you know, kind of manageable. They kind of float around us. Our job, our marriage, you know, finances, exercise, all are things that are kind of manageable. We get sick, we got to deal with that. We get, you know, whatever comes up. We have stuff we have to manage. So all the it's, I can deal with it. Right? You got to deal with it. I can deal with it too. So we got to deal with it. Sometimes it gets pretty big, and these switch. Okay, so this becomes me, and this becomes it. Right? You're diagnosed with a disease. Ah! RP, macular degeneration. So you have retinitis pigmentosa. Yeah. Oh, what does that mean? Well, it means you're going to lose your vision. What can I do about it? Well, nothing. Nothing. You know, your whole system starts to, start freaking out, and this overwhelm, right? It just becomes bigger than you, and you go fight or flight. This is where we go sympathetic. Fight, I don't believe it, denial, and you start freaking out. Or flight, depression, you retreat, you don't want to talk about it, you want to pretend like it doesn't exist. Any of these eye conditions, not me, he was lying. Doctors definitely, I don't know who he was talking about, but it definitely wasn't me. Clearly there's a mistake here. So Nobody in my family has it. I don't know what you're thinking. But anyway, there's coping mechanisms that we do. But again, we have to look at what really happens is this overwhelm. We lose our control, our sense of empowerment. And it is huge. It's overwhelming. How do I deal? What do we do? So what we need to do is get us back to the right perception, the right frame of mind, the right perspective. That means this is you and this is just it that you have to deal with. How do you get here, right? Most people with these conditions are still living with it, whether in their denial, they're angry about it, or fight or flight, Whether it's fright, they're just ignoring it. Yeah, you're losing your vision. Just completely headless, just ignoring the whole concept. So it's just, Tommy syndrome. They're just tuned out. Can't see it, can't hear it, can't talk about it. Just, So that's a stress response. That comes from lack of empowerment. You're totally disempowered, you're totally overwhelmed, and you have no control over the situation. Who wants to deal with that, right? So we get back to here through education. What can you do? This is why we're doing this here. We want to get you from here to here. Realistically, what can you do? What is your disease? What's going on? What is this whole thing that you have? What is it? What is it? What's it? Right? This is it. So that's really what we're trying to do. Once you get back here, and let me get back for a second. So when you're in stress mode, here's what happens to your brain. You do not access creative problem solving. Do you guys, anybody hear that? Yeah. When you're in stress mode, you can't access your creative problems. Everything's in black and white. It's do or die. There's no options, no creative. When we're relaxed, we can access a smarter, more intelligent part of our brain. It's not our reptilian brain. This is our larger brain that we've evolved that makes us human and higher intelligent, that we can come with creative solutions and problem solve and figure things out. That's what we want. We want to figure things out. You can't figure things out when you're stressed, angry, depressed, anxious, right? You need to be educated so you can relax. Then you start to, oh, wow, there's hope, there's possibility. Oh, I didn't know that. Okay, so when my doctor said there's no cure, all right, so it just meant that there's no drugs or no surgery yet, which there may be, but beyond that, there's still, oh, okay, so what's causing it? So now, we're getting information. This is shrinking here, and you're getting back in control. That make sense?
Yeah.
Okay. Important, right? So whenever you start stressing, keep this in mind. We want to get back to perspective. And what happens when you start focusing on your disease or anything, good or bad, it's going to magnify. In psychology, called magnification. So just be aware of that. To retreat into a monastery up in Tibet. That's flight. Could work, help for a little while, but that's still flight, right? Meditate's one way, all right? It's not the only way. Now here's the thing with meditation. You could also do it with hobbies. The goal of this is to just forget what's going on around you. Forget your body, your disease, you're hot, you're cold, you're too skinny, you're too tall, you're too short, you're overweight, you're losing your hair. Or your environment. People stressing me out, my job, it's too cold, it's too hot, it's too humid, whatever's going on around here. Forget it. Or time. Oh my God, I gotta do this and that time, and oh my God, am I anxious, and what's gonna happen in the future, and I'm worried about the past, and that's time. Be present, right? Every major discipline that teaches spirituality or mind or wellness, mental health, be in the present, right? Present is where peace and happiness is. So you don't have to just meditate. Meditation is dancing. It's arranging flowers. It's martial arts. It's doing sports. It's playing with animals, hobbies, dogs, hanging with friends, going out to a meal. Just make it constructive, you know? 1 glass of wine is great. 2 bottles, maybe not so much. But then again, if it's really good wine, you know? So again, the goal is to make sure whatever you do that's not substance abuse, to get you out of thinking of your stuff, do more of that. You know, your hobbies, your interests, just do it. And sometimes it may need to change, you know, explore different ways to get out of that, you know, the problems that are going on. Exercise daily, you know, again, that's kind of a no-brainer. Everybody knows how important exercise is. Really difficult for a lot of people to get consistent with a program, but do something. You know, 20 minutes a day, whether it's stretching, walking, mix it up. Find something that works for you, and get your proper rest. And that means restorative sleep at night. What's proper? Maybe for one person 6 hours. Another person's 9 hours because they run more stressed or they just burn it, you know? How do you know? You feel rested in the morning. Is it going to be every day? Of course not. But most of the time, you know what time you got to go to bed. Usually the rule of thumb, Chinese medicine, be in bed before 11 o'clock. You know, when you're younger, you got some abilities to play with that. And occasionally you go out, dinner, parties, weddings, stuff like that. But generally you want to try to be in bed and asleep by 11. You know, good 6 to 8 hours, sometimes 9, depending on what's going on. Again, manage your external stress factors, negative thought patterns, right? Just identify them. What is bothering me? What am I, you know, doing in my head? What do I keep magnifying or focusing on? Just take an audit of that, an inventory of your mind. Practice mindfulness. What are my thoughts? Where are my thoughts consistently going to? Do they go towards anxiety? Do they go towards depression? Do they go towards hopelessness? Do they go towards pity party? Poor me? Do they go there? Which we all fall into sometimes. But are they the majority of the time? Is that where they're at? That's a problem. Or do you look for things to lift you up? Are you spending your time doing that? Which is what we recommend. You want to join a positive support group, right? Support group, not always supportive. You know, a lot of pity parties. A lot of misery seeks company. You know, how do you know? You feel better after interaction, or you feel worse? You know, after dealing with a person or a group, do you feel inspired, uplifted, energized? That fed you energetically, spiritually, emotionally, whatever. You feel better. That's positive support. Do you feel worse, defeated, hopeless, sick to your stomach, angry, depressed? That's not really a good support group, in my opinion. You know, somebody adding to your stress, or is the nature of a group adding to your stress? Leave it. I don't care if it's, you know, the top online support group or whatever. If it's not, you don't feel better, you're not opening your, remember we talked about, if it's not opening your mind, relaxing your mind, and you're getting your creative, what's possible, that's what you want. So another little trick that I learned throughout the years is a kind of cool concept that'll help you take you out of a stress thing, if you can remember, is that you can't observe and be at the same time. What that means is, like, you can't play soccer and watch soccer at the same time. So it goes like this. You're kind of stressed out. Oh, you know, I'm getting angry. I just can't believe this happened to me. Why doesn't somebody come up with a cure already? What the heck? It's gone. You know, you just start getting in, or you're like, what am I going to do? Oh, in the future, you know, your just mind starts going. You say, well, what, you know, am I going to get to drive? Am I going to lose my kids? Am I have to take care? Everybody's going to take care of me, and I don't want anybody. I don't want to be dependent. I want to be a pain in the butt, and I want my job, and I'm not going to have any money. And, you know, all these things start going. You start running that way. You have to, when you figure out to stop and observe that you're thinking that way without judging yourself. You don't want to, like, bash yourself. Oh, I can't believe I'm riding it again, because that's just another stress response. But just to observe, oh, I guess I'm stressing again. Or There we go again. It's thing going off again. The second you identify or observe the thoughts that you're having, they're like 50% of the emotional charge is gone right there. Why? Because you can't stress and observe yourself stressing at the same time. We're not wired that way. So you're automatic. You may still feel a little not so good about it. You don't like the situation. But when you acknowledge, you're like, oh, it's almost like a third party. It's called disassociation. You're kind of like disassociating. It's almost like a third person. Like, oh yeah, there goes Andy again, worrying about whatever, And then over time, you start to catch yourself faster and faster. And then it actually takes on humor. Because you're like, oh, yeah, that old thing again, Mr. Grumpy is, back at it, So, again, try to catch yourself. And you'll see, it's a practice. It's an art, it's something that you're not going to get the first time, but see how it feels for you. Don't take my word for it. Check it out. It may work for you. Reduce stimulants. Stimulants, again, sugar, caffeine, alcohol, nicotine, cigars, all the good stuff. No. They increase acidosis, speed up oxidative stress, inflammatory, and reduce blood flow. Right? That's why they say smoking, number one cause to accelerate macular degeneration and glaucoma. Why? Oxidative stress. There's nothing more oxidizing. Wine and, wine is, cigarettes, smoking. Especially the non-filtered ones. Man, how do you do that? And be good to yourself. This is like kind of seems obvious, but we're so busy taking care of everybody else. Like, it's amazing. Like, you got to stop and schedule time for yourself. And I don't care if it's like taking a half a day off. I don't care if it's wearing your favorite shirt. We all got, like clothes. I'm going to save this. Wear it. It's your favorite. I'm going to save my favorite mug. Drink, use your favorite mug. It's your favorite. Use it, Put music in your, create your space. Do things for you that make you feel better, because you're better use to other people when you're good and energized. We get worn down. Even if you're great and you're helping people and you're doing community service and that's uplifting, it's still going to wear you down. You still have, it's balance, right? We have to take care to ourselves. And we can't expect other people to do it. Other people can help and they can try, and our spouses and friends and family, they can contribute, but nobody really likes things, we all know the way we like them better than anybody else. So do that. You like things a certain way. So make those things a certain way, as long as they're not hurting anybody, or, put the right music on, the right colors, paint your house the way you want it. It's your life, Enjoy. Diet and supplements. Man, I'll tell you, this is toughest. Not so much supplements, but diet. Change somebody's diet. That is tough stuff.
Like
Definitely. Man, it is. It's a slap in the face. I'll take the supplements. I'll get the acupuncture. Man, I'll even exercise. Diet? Oh, no. Yeah. All right, so let's start off with the easy stuff. All right, we're going to start with the vitamins. It's easy. All right, so generally what we recommend is we get our antioxidants through food, generally. All right, vegetables, leafy greens. We want a good antioxidant eye formula. There are some conditions like Stargardts, we don't want vitamin A, retinal palmitate in, RP, we don't want vitamin E in there. So you kind of got to look and make sure it's an appropriate formula for your condition. But we want a good, strong antioxidant formula. Your nutrients are going to provide the antioxidant activity that your body needs to deal with this oxidative stress situation. Lutein, zeaxanthin, astaxanthin. These are high-potency carotenoids that will really help mostly the macula, but will still help with neuroprotection of the entire retina as well as the brain and optic nerve. So I do recommend those for all conditions. But most of the research has been done for macular degeneration. DHA, omega-3 fish oils, oodles of research on that, all right? Cod liver oil is one I recommend most, just because it's the kind of the cleanest. If you get like, you know, there's a lot of people worried about heavy metals or mercury or, you know, impurities in fish oil. My preference is because it's the highest content of naturally occurring vitamin A and vitamin D, both of which are critical for most eye conditions. So I'm a big fan of cod liver oil. Research has shown, not in addition to its neuroprotection for eye and brain and the entire nervous system, is that I believe the research was 5 to 8,000 milligrams a day of omega-3s showed to dramatically improve visual fields for glaucoma and RP. So here's the thing with that. That's kind of a lot of oil to take, you know, especially if you're doing like, you know, olive oil and stuff like that. I usually tell people if you want to get up to those levels, titrate it, all right? Start with maybe 1,000, then a week or two later go to 2,000, slowly build it up. That'll help preserve your visual fields, your brain, all the nerves, all right? Why? It's fat, right? Oils are a fat. Nerve cells regenerate from fat. You have to have good fat in your diet if you want to regenerate. That's why they call fish brain food. Those oils will regenerate. Nerve cells run on glucose, blood sugar. They regenerate from fat. No fat diet, not good. Not good at all. And we'll get to that. Taurine, critical. It's the most abundant amino acid found in the retina. There are different doses. I generally recommend 2,000 milligrams a day of that. Some people more, people less. Use the bowel tolerance. Some people are sensitive. If you take too much, you kind of get the runs a little bit. So ginkgo biloba for blood flow, brain and ocular circulation. There are various Chinese herbal formulas that we use for certain eye conditions that can be beneficial. And overall, I'm a huge fan of green drinks, like a green powder drink. Any health food store has. Add it to a shake, a smoothie, if you do juicing, anything like that. We use spirulina, chlorella, blue-green algae, wheatgrass. Take a scoop, put it in water first thing in the morning. So many benefits, just general health benefits of green. It alkalizes the body, cleans the blood, helps with acidosis, helps with oxygenation, cleans the liver. It's very similar to the antioxidants that help clean out the liver in the body and help with the liver stress. Man, I could go on with the benefits. I could do a whole seminar on the benefits of greens. Just take them. It's not easy being green. Healthy vision, diet. All right. Don't shoot. No. All right. Generally, we want to go to high alkaline, low acid diet. All right. More vegetables, less sugar, junk. All junk food is really acidic. Meat, generally more acidic. Sugar, acidic. Alcohol, acidic. We want alkaline. All right. These are the best diets that have also been proven for anti-cancer. Macrobiotic diets. Our bodies like alkaline diets. They do better. All right. That's what the greens do, is they help to alkalize the body. We want to reduce refined sugar, salt, white flour, things like soda. Aspartame is like one of the worst things found in diet soda and diet drinks. Just get off it. Not even going to go into it. Is so toxic to the neurotoxin, becomes formaldehyde in the body. Just get off diet soda. If you're going to drink, do aspartame free, like regular soda or something like that. Refined sugar, salt, white flours, bleached. More colored vegetables, leafy greens. These are good. Antioxidants, carotenoids. Consume good fats. Right. Why do we say we need fats?
Keep everything lubricated.
Regeneration of nerves, lubrication, dryness, right? A lot of our conditions too get dry eyes, dry skin. We need it. Neuroprotection. Coconut oil, olive oil, fish oil, eggs, avocado, nuts, seeds. We need it. None of this junky, no-fat diet stuff makes me crazy. You need fat. have to have fat in your body. This is good fat. This is not like blubber fat. Eliminate trans fats and fried greasy foods. This is the bad fat. This is your cakes and donuts and Dunkin' Donuts and Krispy Kremes, and you gotta live, you know, once in a while. But here's what happens. When you get off that stuff, you try to eat it, you know, especially every decade, your body becomes a lot less tolerant to junk food. But greasy fried foods, that's oxidized rancid fats. There's nothing that's more promoting of oxidative stress than greasy fried foods. That includes scrambled eggs, right? Because I'm having eggs, frying butter. If you're going to do eggs, poach them, hard boil, or slow cook them. But it has to be slow heat. Anything that crackles or sizzles, that's you basically telling you. I know. I could, if it was healthy, I could live on French fries. It's my childhood thing. I could live on French fries if it was good, if it was a health food. Really. No, not French fry diet. Maybe I'll have a book. No, but seriously. What we do now, because seriously, it's one of my favorite foods. We stick them in the Foreman. Or we bake them, cut them real thin, or we just bake them, and that's how I get my fix. But frying is just, it's so bad, like just health-wise. Does it taste good? Yes, but calamari and fried chicken, it's so good. But onion rings, they're great. But no, just seriously, and you'll see, like, you notice, and after you eat it, if you get digestive stuff after it, it's really not good. You're taking fat that may not be bad, like olive oil or whole butter or something, and you're frying it up and you're making it rancid, and then you're putting it in your body, and that is just hell for the heart. You know what I mean? It is just, that's heart attack city, which again, we know will contribute to macular degeneration, glaucoma, any neuroinflammatory condition, especially MS. Those type of inflammatory conditions. Organic proteins, free range, yeah, expensive. If you're going to do dairy, milk, go organic. It's expensive, yes, because it's not commercial, and most of the non-organic stuff is not even a food at this point anymore. And really control blood sugar irregularities. We know diabetes is crazy, really crazy rampant right now. A lot of people with diabetes. What happens when you have insulin surges? The number one metabolic trigger of oxidative stress. Hypoglycemia, your blood sugar crashes too much. If you tend towards that, you got a fast metabolism, eat every 3 hours. Just keep trail mix, get something. And if you have blood sugar issues, get it under control. Diet, exercise if you're pre-diabetic or insulin resistant. If you're to the point where you need medication, I have a lot of people that I know are just like, well, I'm on the medication, so I can eat whatever I want and do whatever I want and just, do an insulin. It's a better idea to be a little bit. I have a lot of patients who have macular degeneration, glaucoma, and diabetic retinopathy. When you start combining these conditions, it makes my job really hard. It's a lot of work. It's a lot of work. I don't like it. I like to keep it simple. So the more you guys can do, the less I have to do, right? This is homework stuff. And do what you can. You know what I mean? And this should be, if you don't eat healthy, don't drop it, because you may get sick and detox too. Slowly start to change. Do the things you can do and that are easy for you first. All right. I often get asked what can affect the outcome. Why do some people respond? Some people don't. Some people respond better. Some people don't respond very well. How advanced the condition is, right? Somebody's really advanced. There's a lot of nerve death, a lot of damage. Big mess, tough to clean up. Little mess, usually easier to clean up. Prevention, much easier strategy than resurrection. Degree of emotional stress, right? You type A, you're really stressed out, whether it's your vision or you got other stuff going on, you can't relax. It's a problem because I can't get you into that sympathetic restorative. You may still get results. They're definitely not going to be as good. Usually, I track people. I have my own system. By Wednesday, a lot of people come in high strung. You know, they're traveling, it's a new experience, they're out at home, you know, there's a lot going on. By Wednesday, people usually slip into the groove. They're into it. You know what I mean? They're in. So by Wednesday, most people have usually calmed down. Pretty relaxed. Stress is down. Yeah, sleep's getting better, you know, most of all. I can see the tone change. I'm okay with that. If like Thursday or Friday comes and I'm coming back in and they're still like, yep, still here, needles are all here, and you thought you forgot about me, you know, like, okay, so we got to see what's going on. And then it's not like, I just want to talk and find out if there's stress factors that are going on and what we can do to help try to manage them. Are they on anxiety? Did they just lose their job? Are they coming out of divorce? Or there's financial, like what's going on? Other coexisting conditions, health conditions, right? Do you just have like a, you know, maybe an early stage retinitis pigmentosa or glaucoma, or do you have heart disease, diabetes, stress, horrible marriage, you know, you just lost like all this stuff going on, stress, metabolic stress, eat a poor diet, like, you know, that's a hot mess. You know, it's really like there's so much. If it's simple and you're exercising, it's very easy, much easier situation to deal with. Willingness to receive treatment. All right, people they're willing out of your own free will. You may be skeptical. You may be cautiously optimistic. You may even be a little bit cynical. That's fine, but you're here of your own free will. All right, you're willing to give this a try. That's all the agreement I need from somebody. You're willing to try, you know, let's just see how it goes. Occasionally that's an issue. Maybe every 2 to 3 years you get like mom brings a kid in or something like that and the kid just doesn't want to be there. Usually it's a mom-parent thing. Sometimes a husband-wife thing or, you know, brother-sister thing, but usually it's a parent bringing a kid in. The kid just doesn't want to be there. It's like after a day or two, the kid's just, you know, the kid's just like, you know, just, I can't, they're cool and they like me, but they're just like, oh, yeah, you know, and like, not going well. So I tell the parents, I'm like, look, why, you know, it's the kids, you know, I love kids, you know, I don't want anybody it's supposed to be fun, but they're not wanting to be there and the parents are forcing them and I'm like, this is just not working. You know, I don't want to have that type of relationship and the parents are like, you sit there and you take those needles. Like, oh my God, are you kidding? You know, so I don't, yeah, and again, you know, and again, if the kid's like, you know, sensitive and but they're okay with it, that's one thing, but they don't want to be there. It's like, you know, you're out. You know, let's give them an option and let's try this maybe in the future or something like that. But that's my thing. If you're willing, your will isn't there, then it's not right. Compliance. Take your supplements, get your sleep, come for acupuncture, just do what you got to do. You know, and again, I understand, you know, we need to go back. Hotels, it's a little not your typical bed sometimes, but just try to, you know, do what you can to get your rest. Smoking, alcohol, drugs, again, I don't even lecture about smoking, and I certainly don't, you know, not take patients because they don't smoke. Everybody knows, but I will educate. So again, we talked earlier, smoking, one of the number one causes of accelerated oxidative stress, neurodegenerative disease, cardiovascular disease. So here's the thing, people still smoke. That's fine. I'm not going to lecture them about it. They know they shouldn't smoke, but let me tell you how it's impacting our treatment, okay? It's dehydrating, acid producing, all this stuff that you know, so you get educated. On top of that, there is a difference between smoking a pack a day and 2 or 3 a day. You know, it's not great, but I'd much rather see somebody chain smoking throughout the day and shifting to, all right, you know, maybe I'm going to have 1 or 2 at the end of the day or something like that. It's better. It's not all or none. So, you know, just try to educate them that, you know, if you can't, that's fine, but let's try to at least cut it down. And we need to do a lot more oxidative therapies, and they need to hydrate because smoking dehydrates the body, and we need to really, really crank up the antioxidants. There are specific antioxidants that I have to give for people who smoke because it robs certain key antioxidants. So again, we'll just deal with it. You know, I don't condone it. I don't promote it. Everybody's got things. Everybody's got vices. We all have things that we do that we know we shouldn't do, but we do anyway. Alcohol too, no problem. Generally, I recommend beer and wine is okay. Hard alcohol, a lot tougher on the liver. Liver is where our antioxidants come from, mostly. Do liver damage, you're going to destroy your antioxidants. Your detoxification pathways, they're going to get shot. So little alcohol, not on an empty stomach, with food, glass or two, beer, you know, maybe a glass of wine with dinner is fine. You know, beer occasionally. But then again, you know, you go to an event, you want to let loose, you know, just deal with it. But also, you know, drugs too. A lot of patients smoke pot. A lot of people use recreational and pharmaceutical drugs. Again, it just increases stress, increases oxidative stress, and it's just going to really work against what we're trying to do. And I understand that people are stressed out. This is tough stuff. On top of life, now we have to deal with vision loss in family members and loved ones. So some people choose to deal with that through substance abuse, drinking, alcohol, which is fine. That's your choice. That's not for me to judge or lecture or, you know, to make you wrong, because you're not. But I just want you to understand that there might be a better way, and let's try to get that under control so we can help preserve the vision if that's something you want. And certainly, especially while you're here, I usually tell patients, like, if you want an occasional glass of wine or something, like, it's fine, but, once in a while we've had patients come and drinking a bottle of wine every night, or, and again, I don't know if it's just, party time, but it's like, you can't, do that and expect to get good results. Poor diet, malnutrition, again, we just talked about eating the right foods. We want to slowly make shifts towards making healthy choices. And I want to talk about stem cells and gene therapy and some of the biotechnology. Some of you guys may know a little bit about it. Some people may know a lot about it. Some people may know nothing about it. So I'm by no means an expert in any of these fields, but I do really try to keep up and have a basic understanding of what's going on. I have my own opinions, which I will share with you about the upsides and where they're kind of getting caught up and why they're not as clear, but let's talk about it. So stem cells are what we have here. They generally come from bone marrow. They've also found you can take them from adipose or fat tissue, okay? So what they are is, it's kind of like a stem cell. Wherever it mutates to, wherever it migrates to, it will become the surrounding cells. So if a stem cell goes to the liver, it's going to become a liver cell. If it goes to the brain, it's become a brain cell. If a stem cell is released to the lungs, it's going to become a lung cell. Most stem cells are used for regeneration and repair, right? That's why I have stem cells, to rebuild and repair. That's what stem cells do. So the theory is that with conditions, retinal and optic nerve degenerative conditions, that there is a breakdown of tissue and not enough stem cells to help regenerate the tissue. So what they want to do is go in. They tried embryo stem cells, not working so well, embryonic stem cells, because there are other stem cells and our immune systems were rejecting them. Okay, so not the best. A better way, or a more effective way, was to use your people's own stem cells. So they're taking their own stem cells, doing injections into the eyes in an attempt to regrow healthy retinal cells or optic nerve cells or whatever, choroid, that whatever's damaged. Okay, so that's the goal. Regrow healthy new cells, put them in with the understanding that, or the theory that there's not enough stem cells being delivered to the eye. I don't necessarily agree with that, and here's why. If you have retinitis pigmentosa, if you have Ushers, if you have macular degeneration, you cut yourself, you repair, you get sick, you recover, you have your stem cells are working fine. Okay, it's not a stem cell issue. I don't believe it's a stem cell issue. It may help the situation, but there's definitely no deficiency of stem cells. Maybe if somebody's been really sick or they're really getting up there, maybe 90, 100 centurions, maybe the bone marrow is starting to decrease a little bit. but most of us definitely do not have any insufficiencies of stem cells. We're producing them all the time and regenerating. So, but anyway, the treatment is to inject the stem cells into the eyes, try to regenerate the cells. They're very clear about stem cell therapy that, again, it will only help preserve cells. It will not bring back dead cells because, as discussed, we can't, dead tissue is dead tissue. Gene therapy. There's two discussions going on with this. One is that the gene that there's missing, the gene issue is causing missing proteins that are going to rebuild the retinal tissue. So they figure out what genetic deficiency you have. That's why you kind of guys are giving your, checking your genes and see if there's a genetic issue. And then they're going to isolate that gene and correct it by an injection, and hopefully your body will start rebuilding proteins to build up the retina. Okay, that's one side. The other gene therapy that's being discussed is identifying the faulty genes and basically correcting systemically the genetic abnormalities, which to me is really far out. You're talking about like completely correcting genetic abnormalities without understanding what caused those genetic modifications to begin with, puts us into epigenetics. So these factors that cause the gene mutations or the gene signalings are being totally disregarded. So you can fix the genes, even if you do something that would potentially or conceivably fix your gene pool to make it perfect, and so you wouldn't have retinal conditions or Alzheimer's or Parkinson's or anything. But what about your emotional state or your consumption of junk food? What if that was the factor that switched on those gene expressions? When they come back, because you didn't change, that's the cause. Right? We're talking about what caused the gene modification and expression in the first place. So you could fix the gene, but if you don't fix the cause, it's going to come back. So maybe, and again, you're talking about in the larger picture, really genetically engineering perfect people and doing away with disease, which maybe far down the line is possible, but they're nowhere close to getting that. Again, is it possible? Sure. Bit of a stretch for me right now, and that's just my opinion. The bigger picture, which I just started to allude to with stem cells and gene therapies, is this. We need to understand the environmental impact on the disease, or the systemic nature of what's going on, okay? Stem cells, planting stem cells is not unlike planting seeds in a garden and having them grow, okay? You plant a carrot seed, you're going to grow a carrot. Tomatoes, tomatoes. Sunflowers, you're going to grow sunflowers, all right? So will a healthy garden probably grow in this environment? Sun, we got sunlight, we have oxygen, no pollution. It's a clean, warm, eco-friendly environment. Is that conducive to a garden? Yeah. Right? So how about on this side, if we look at more an industrialized, polluted, toxic, acidic, oxidized environment? If you try to grow a really clean organic garden in this environment, what do you think the outcome would be? Right? Probably not so good. There's one answer I'll tell you guys in a minute. But generally speaking, if you're trying to grow healthy new cells, you have to improve the environment. It could be the environment that caused the breakdown to begin with. The oxidation, the inflammation, the poor circulation. This has high oxidation, high acidosis, high inflammation, and not good airflow. It's not conducive to life and healthy regeneration. This is air, clean water, sunshine, balanced alkaline acid environment. Okay? So if you're going to plant seeds or retinal stem cells or any stem cells without improving your diet, exercising, the right supplements, dealing with the factors we talked about, inflammation, oxidative stress, you're planting seeds in a toxic garden. I mean, you know, is it really that difficult to understand that that would not be, maybe short term, okay? Now, I actually would go towards GMOs from this side. You would have to genetically modify those structures, those cells, to withstand. So the only way this could happen is if they create stem cells that are able to withstand a toxic environment, which is a really tough order. Okay? Really tough order. So that's the only way I see that happening successfully. So they have to take stem cells and make them resistant to any environmental, which is Superman, right? Right? You know, it's not happening. This, we clean up the environment. Now we're talking. Now we've created a fertile environment for where we do this type of treatment. There's a higher probability of success. But guess what? When you have this environment, our body's own stem cells will go there and migrate to the stem cells, and you get regrowth and regeneration anyway. Why do you even need stem cells? Or implantation. So maybe it'll be a jump start, but ongoing, if our body has sufficient stem cells, right? This area I'm also really love. And again, this stuff is coming, and I think coming fast, because we only have what's called the Argus and the Argus 2. This is awesome. This is basically, we talked about earlier. Remember we talked about how the retina just takes in the light, it's an antenna? Well, they're creating an artificial retina, which you can do. They already know how to create things that pick up light signals. Then they just transmit them to the brain. Now they're using a hard wire, right? Sunglasses, they basically take an electrical code and they send it through a hard wire to the brain to help with an image, right? You're starting to see stuff. They'll be able to do this real soon with Bluetooth, right? We went from speaker wires with the code, now we all have Bluetooth. You'll be able to take an artificial retina, Bluetooth it to a chip in the visual cortex or somewhere in the neural pathways, and vision may not, it could go any way. It could maybe not be as good as we see. It could be ridiculously HD vision. Who knows? But this stuff I love. The biotechnology, I mean, and again, this is probably going to be more for people who are like kind of blind, like lost their vision, and you know, they have all the antennas are shot. The retina and the optic nerve are shot. There's no hope for regeneration. That's when you want to put an artificial retina in, bypass the optic nerve, send the information to the brain, because as long as the brain gets the information, but we need to use the acupuncture and these other treatments to help with the brain's neuroplasticity, because it's going to have to relearn. Right, there's going to be an education process. So a lot of this depends on brain functioning of the visual pathways in the visual cortex. Love this stuff. Really, really excited about this. A lot more reasonable and probable in short time than some of the long-term biochemistry messing with genes and stuff. In terms of like what can technology produce for people, I love this. I really do. I think this is going to be, this Argus and the Argus 2 that's out now is like how computers in the 70s filled like 1,000 square foot rooms, and now it's like in a cell phone. You know, it's just a hard technical, raw, old school technical thing that's going to become obsolete, and it's really just going to accelerate in technology geometrically so fast. Okay, so generally, one of the things I ask patients to, I understand a lot of people are very private about their conditions, and I totally respect that. If you have had good results, or you know somebody who's on the fence or kind of just got diagnosed with it, you know, and they're like overwhelmed, and we talked about education puts you back in the driver's seat. This is education. So share it. Want to share your experience, share your story, share the information. Chances are you guys heard about this from somebody else. Somebody else shared you, gave your book, you saw it online, it was something else that was shared with you guys. So now you have information, you know, and we're going back to your doctors or your friends. Oh, I got acupuncture, my vision got better. How? Your doctors, you can explain now. My patients, you go back to your doctors. Oh, well, you know, vision's better. What did your acupuncture say? Something, I don't know. I read a brochure. It said something about cheese. I don't know, cheese. It's cheesy, sorry. But you can explain now to your doctors, and we have a probable mechanism of action that we can explain, and we can back up with some research. We have some patients who, really want to, they just have a response and they feel passion. They want to offer testimonials or blog posts or share their experiences that way or do case studies or, that's how we got into the research with Johns Hopkins. One of my patients was at Johns Hopkins working with them, and they said, look, I'm going to this acupuncture. Their researchers were really interested in doing acupuncture research. That's how it happened. So through communication, that's how these great things happen. It's just, just getting the right people together at the right time to make things happen. Doors open up all over the place. So always remember, with information, now you have hope. You guys are stuck in hopeless situations. When you get information, you get educated, you go from a hopeless, fearful, anxious, depressed, overwhelmed state to something you have now, something you can work with, something you can further investigate, share with other people who are dealing with this. So that's what I give to you. So thank you for your time. I hope you guys learned some stuff. It's good stuff. Anybody have any questions? Quick. Yeah.
I know they do a lot of research and stuff on this, but have they ever researched twins, and one twin might have had RP and the other had more a degenerative, and figured out what the difference is, why one got it and the other didn't when they had the same?
I give you a short answer and a long answer. I'll give you the short answer. Yes, I actually had two twins that I treated. One had RP, one didn't. It makes the case for epigenetics.
Right.
They both had the same genetic tendency, both of them. They had the same gene, RP gene. One expressed it, one didn't. Huge question mark. Why? That is like blew genetic predeterminism out of the water. Genetic predeterminism is when you are born with a genetic predisposition and you don't have any choice in it and how it's going to express. This blew that out of the water. You got identical twins, not fraternal twins, identical, with the same genetic makeup. One gets RP, one does not manifest RP. How does that happen? Correct. Has to be epigenetics. Then the enormous task, which one of my patients are starting to take on right now, is researching, looking into this enormous field of possible causes. But that's a genome project. That's a big undertaking, but that'll help give us some more answers. Great question.
I'm studying to be a nutritional therapist.
Yeah.
That was one of my...
Yes. That's great. All right, guys.
Thank you.
That's a wrap.